So without further ado, I shall hand over to Alison and Chloe.
So I'm Alison. I'm a dietitian, and as of this week for 30 years in the NHS, and I have a private practice under the name of the Unexpected Dietitian. And my interest in MCAS came from my daughter, who has the trifecta of POTS, MCAS and hypermobility and its associated conditions as well.
So hi, I'm Chloe. I'm a dietitian. I've been a dietitian for sort of just over 10 years. My husband has Mast Cell, which is why I became really interested in the area. Some of you might have heard me talk before, but yeah, that's me.
And we've kind of set up to do this between us. So we've had a lovely list of, well, 6 pages of questions submitted in advance, which is fantastic, covering lots of different areas. So Chloe and I are going to kind of chat through the questions, and I hope that kind of works out nicely for everybody. So shall I start with your first one, Chloe?
Yeah, that sounds fun.
It's a bit of a long one, and I've printed it out too small for my eyesight, so that's not helpful either. So 4 years ago, I became extremely ill with severe food, chemical, environmental allergic reactions, diagnosed with HATS and MCAS, and my diet was reduced to 6 items. And under the care of the NHS and dietitian and consultant, introduced more foods, but can't tolerate many foods like fruit, tomatoes, eggs, oats, dairy, to name a few. Should I continue to try reintroducing small amounts of foods in the hope that I'll start to build up tolerance, as happened with the other foods?
I think that's a really good question. I think it really depends on a number of things, but one of them is the type of reaction you're experiencing. So people's reactions can vary hugely from, skin symptoms to gut symptoms to anaphylaxis. So it really depends what reactions you're experiencing. I think reactions can change over time, even by day, can't they, Alison? They can vary hugely. So I guess it's what else has changed during that time. Have you started medications that might have stabilized things out? Is it pollen season? Are you super stressed? So it's really thinking about the best time to reintroduce those foods and the other things that are going on as a whole. And I think that, like you say, things have changed in the past for you and you have managed to build on the foods you were having before. So I think it is really, really important to keep on trying foods. It might just be thinking about how you do that and in what environment you do that. Do you have anything to add to that, Alison?
I totally agree. I mean, it's obviously if it's anaphylaxis, that's a whole different thing altogether, and you can't be reintroducing foods in a home environment. But if your symptoms are not anaphylaxis, then you can. And I think, I would go for foods first that were related to the ones that you are tolerating to just expand the range of foods that you're having before you kind of dive into brand new types of food. But as Chloe says, that histamine bucket again, isn't it? Or that and the stress bucket as well. It's being in the right place at the right time to try new foods.
Yeah, and I think, like you say, looking for patterns in the foods that you're eating. So sometimes when we look at foods, there is an obvious pattern in terms of like food chemicals or types of food. So actually building upon those can be really helpful.
Yeah, absolutely. Okay.
So do you want me to ask your first question, Alison?
Go on then.
Have you got any advice on accessing a dietitian if your GP has already referred you locally and the referral was rejected?
So I think this is really tricky because there are as far as I know, services for MCAS commissioned in the UK. So if there's not a service commissioned, there won't be a dietitian skilled in that area because people are not going to be skilled in an area that they're not seeing patients in. You may be lucky and find some dietitians with MCAS knowledge, particularly in long COVID services, possibly ME services if they've got a dietitian, but the general dietitian will not be skilled in MCAS. And that's why it's been rejected. So what I would suggest is if you can find out why it was rejected. Was it rejected because there isn't a service and there isn't a dietitian who can actually see people with MCAS and has the knowledge? Because if that's the case, there's no point really pursuing it because you won't get the expert advice that you need. The other option is to think about the symptoms that you want looking at. So for instance, if you've mainly got gastro symptoms, for example, it might be better to be referred to a gastro-dietitian and deal with that set of symptoms, because you'll get the right expertise there. So that would be kind of the way that I would go with that. Don't know what you think, Chloe. Your next question is a little bit similar, actually.
It's really similar. My answer was very similar. So the question I had was about trying to find someone for MCAS and rapid small bowel transit. And my answer was going to be go for a gastroenterology dietitian. Although they might and are unlikely to be specialised in MCAS, there are resources out there to support them. So last year we did a webinar for healthcare professionals about Mast Cell Activation Syndrome, and I get lots of dietitians emailing me for advice about specific patients if they don't know what MCAS is or how to manage it. So most dietitians will go out of their way to find out what a condition is if they haven't heard of it. So it is worth going in on a symptom basis and finding a dietitian specialist in that area. But like Alison said, there are no services set up just for MCAS.
No, and probably until, in order for dietitian services to be set up, normally there has to be a consultant-led service set up first. So that's when you then tend to get the funding through to employ dietitians. So there's a way to go, I think, yet in that, unfortunately. So I'll skip that as your next question, which you just answered. So I'll do mine, because actually it comes in again. We've got a few questions here about histamine, so we could kind of combine them a little bit. So I've got one that says
go on a low histamine diet.
Yeah, so no, it's the answer. Not everyone with MCAS should necessarily go on a low histamine diet. MCAS and histamine intolerance are not the same thing. You can have MCAS and not be intolerant of histamine, and you can have histamine intolerance and not have MCAS. So it would depend on your symptoms, really. So I'm looking at your symptom profile to see if that, and also the sort of foods that you feel that you react to look for patterns to see if histamine was likely. It's important really not to restrict anything unless you absolutely need to. I think that's something we probably both agree on, Chloe. So sometimes it's better to track symptoms and foods and actually work out what group of foods you might be reacting to, and then see someone that can look for patterns in that for you before embarking on different diets.
Yeah, and I think that histamine modification might be a better way of putting it, because I think as soon as you say the low histamine diet, it sounds like that has to be something you do forever. Whereas you might always, if you have an issue with histamine, find you have to, rein it back in, tighten up the histamine in your diet, and there might be times you can have more of it, but it's actually giving you the control. It doesn't mean you have to follow an extreme low histamine diet forever and ever and ever.
Yeah, and I think that's really key. And the next question on mine actually is, how long should you stay on it for? So that fits in nicely with that, which, how long should you stay on a low histamine diet, and when should high histamine foods be reintroduced? And I mean, I don't know if me and Chloe do this slightly different or similar, but I would generally start with 2 weeks, and actually then if someone's having no response at 2 weeks, I probably wouldn't carry it on unless the person's got a history of quite delayed reactions, and then we might carry on to up to 4 weeks and then start thinking about reintroduction. So it's a little bit individual depending on the type of reactions people are having and people's own personal gut feeling about what they're reacting to as well. But that's kind of the way that I do it. Don't know about you.
I would try and do it for the shortest time possible, because there's no evidence for this, but there's no evidence in a lot of this field. But I do find that the longer people cut food out when they come to reintroduce, the more sensitive they become to them. So I think the shorter you can do it, the better. Yeah. Before trying to reintroduce foods, really.
Absolutely. And if you're not seeing any difference within a couple of weeks, it's probably not worth carrying on with, because you would, with histamine, generally see a change fairly quickly, I would have said.
Yeah.
And also for some people, I do an adapted version as well. So I see a lot of people who really struggle with complex information. So I work with a lot of people who have quite high anxiety or who are neurodivergent, or have difficulties processing information. And sometimes we do it 1 or 2 foods at a time and don't do the whole thing together as well. So, it can be personalized.
Yeah, or I try and put a few points in place. So things like not having leftovers or freezing food as soon as you buy it, and try and do some of that first line sort of simpler reducing histamine rather than a full low histamine diet, which for some people isn't appropriate as well if they're really underweight or have other food restrictions that they need to follow as well.
Yeah, absolutely. Absolutely. The less restricted, the better. We're always going to agree on that, aren't we? So the other one of mine was that I'm in the reintroduction stage after eating low histamine for a month, but I'm lost and just winging it. Is there a structured protocol when reintroducing, or is it a case of choosing a food or spice, eating it at increased doses over 3 days? And the short answer is there isn't a set protocol, but there is a longer answer, which is, again, it's about personalizing it, I think. So I tend to do it in different ways. So I'll look at, most people have some sense of what they react to. So I would leave those foods till last, or some sense of, actually, I don't think I have reacted to this food before, even though it's high in histamine. So we might start with putting that food back in. I also look at what's missing nutritionally, particularly if someone's got other restrictions. So say one of the common ones I have is someone who's vegetarian or vegan, and when we've done the low histamine, they've got hardly any protein left. So we'll try and do some reintroduction, or based on things that are more or lower reactivity, or even based on things that people miss the most. So in our household, we're currently trying to reintroduce tomato, because I would kill to cook a pasta sauce with tomato again. It's going slow. It's going okay.
I think like you say, that there is no set way, and you can take it as slow or fast as you like as well. So I think what you described in your asking the question was increased doses over certain days. I do often suggest that, and that will be in the new British Dietetic Association low histamine sheet that's coming out soon. So it talks about starting with a tiny portion on day 1, doubling that on day 2, and then tripling it on day 3. So a gradual increase. But I often find that food, like being scared of reintroducing food, is really normal and occurs quite a lot. So actually, if you want to leave a day in between those increases, or even a week in between those increases, that's absolutely fine. And I think one of the later questions, which I might as well talk about here, is about how to get over that being scared of foods. I think the more you successfully reintroduce, the more your confidence builds. But for my really sensitive patients, I suggest even doing stuff like touching it on your skin first, or touching your lips, licking it, and then before even eating it, and just becoming comfortable with sort of introducing that into your digestive system. Is there anything you suggest, Alison, in terms of getting over that food fear, apart from like building on really similar foods, which we've already chatted about?
Yeah, I think stress environment's quite important, isn't it, as well? Because I think when it is really, if you've had reactions to food, it's incredibly stressful reintroducing food, and no amount of talking it through with anyone like me is going to change that. It is stressful. So some of my patients, if they're sort of into this sort of thing, will actually do some mindfulness or some meditation beforehand as well, or whatever it is that calms them. It can be quite different for different people. As part of that reintroduction as well. So it's whatever feels right for you, I think.
Yeah, I've even suggested listening to music for people that are really into music, listening to that when they're reintroducing, just to have that distraction technique away from thinking about what your body's doing. Because I think it's really hard with something like MCAS not to think what your body's doing all the time. What people will ask you when you see medical professional, what are your symptoms, what's your body doing after food? So it's really hard not to hyper focus on that.
Yeah, and I agree. I think we have to, this is where we probably have to forget what we were taught at home, or some of us, about, sitting at the table and focusing on our food and everything like that might be taught for other conditions, that actually being distracted from what's happening is actually probably better when you're doing this. So you've got a question linked to this, haven't you, which is advice on a low histamine diet for a child.
Yeah. So I don't see children within my private practice. I see 16 and older, but within my NHS job at the moment, I do see children as well. But I would say the most vital thing for, you know, children, a low histamine diet is, we say it for adults, but it's so much more important for children, is get a dietitian because their needs are so much more complex. They need increased nutritional needs because of their growth. Then you've got additional things that come with children. You know, it comes with adults as well, but sort of restricted or fussy eating that at a younger age can become more prevalent. So you've got all of those barriers, and children's parties, socializing with friends, all of those hurdles that you come across, and going to school and going to universities, and all of those things that you as a parent have to manage as well as the child. So I think it is so important to get a dietitian that works in this area. And saying there's no MCAS clinic, there is a MCAS children's service. Joy, correct me, I think it's Leicestershire, is it? And there's a children's dietitian through that service, and you can get local referrals up to that centre if you've got a child with MCAS. And I think there are additional things that you need to think about with children. So certain age groups do need specific vitamins and minerals. So any child under the age of 5 need to take a daily A, C and D vitamin. But also, if I did see a child, I would be less likely to go straight in with a low histamine diet, like a full low histamine diet. I would be doing more of a light version, like Alison was talking about. So, you know, if a parent came to me and said, I think it's tomatoes, then we might just try taking out tomatoes and swapping that for other things without doing anything else. So just taking out 1 or 2 foods rather than taking out multiple.
Yeah, no, I absolutely agree. I wouldn't jump straight into a low histamine diet or a low anything diet. Unless I absolutely had to, just because of all the kind of physical but psychological and social effects of restricting, which we as adults know, don't we? But you know, the impact on children can be even greater, and as you say, their growth as well. So you know, I often do see people recommending online, you know, for children to go on this diet and another diet and another diet, and I kind of, my little dietitian heart sort of dies a little bit, because actually that really needs managing carefully for children. To make sure that they're safe and well.
And it sort of leads into that. So can a very restricted diet, do you think that can make MCAS worse?
In my experience, I do, yes. So I'm seeing, you know, I get a few people coming through who are on multiple layers of different restrictions, and you know, people can get in a real pickle. And I think that we don't know all the reasons for that, but I think we certainly suspect that some of the reasons are to do with the gut, in that, you know, if you're not having a good variety of food, the gut microbiome doesn't like that, it doesn't thrive on that, and that is likely to affect, you know, how you manage histamine as well, because that's all, you know, is gut based as well. So I think that it's just, you know, we're learning more about the gut microbiome, aren't we? Really, we don't know it all yet. It's really complicated, just like MCAS, but we know it's going to have an effect. And I think so there's a physical issue, but I think there can become a psychological issue as well, in that, you know, the fear, the more you start to exclude, the more the fear can grow, and that is absolutely understandable. It's sometimes these symptoms are absolutely terrifying. But I think it all plays back in and becomes more stressful, and then you get the stress as well. So you've got all those things kind of joining together to make it harder and harder to reintroduce foods. We just have to go really carefully, don't we?
Yeah, and I think we know that mental stress can trigger or flare up MCAS. So why would physical stress not do the same? So whether that physical stress is coming from an illness or from not getting the right nutrients and becoming malnourished. And malnourished, you know, can mean that people are losing loads of weight or becoming underweight, but it can also mean not getting the right vitamins and minerals you need to support the functioning of your body. And actually the enzyme that breaks down the histamine in our bodies needs specific nutrients to function well enough. So unless you're getting those, things could be getting worse. So not only are you overproducing histamine and all these other chemicals that your mast cells produced, but then because you're not getting these vitamins and minerals, you're not breaking it down as well either. So it can become a bit of a double-edged sword, really. And like you say, gut microbiome is huge, and we do know it plays a role in other allergic conditions. So in my mind, I don't see why it wouldn't be involved in MCAS, when 70% of our immune system is in our gut.
There's also, I think, lessons from other malnourished states as well. So think of in eating disorders, for instance, when people are malnourished, it affects just the physical aspect of the gut motility, stomach acid and things like that as well. So you tend to get, more reflux, more choking, more constipation, as people become more malnourished as well. So there's those aspects of it as well, which could be mistaken for MCAS reactions, but might actually not be.
I guess it kind of links to the fact that this person's restricting calcium. So it's been basically, the question is, after the birth of my first child, I had severe diarrhea, ate a lot to keep up. I was bloating, finding it difficult. So my friend advised me to stop gluten and dairy. And initially things got better within 3 days, but since then there've been ongoing issues with diarrhea. And then they've avoided dairy for 20 years, but been diagnosed with osteoporosis. So basically is wondering whether it's worth trying to reintroduce dairy. So my thoughts are there are lots of other ways to get in calcium, not just dairy, if it was dairy that was causing the issues in the first place. If I was seeing this person in clinic, I'd have lots of other questions, like what other tests have been done to see what was causing that diarrhea in the first place. Have they had a celiac screen? Have they had a stool test that might sort of look at gut inflammation, so something called fecal calprotectin. But there are other ways to get calcium on a dairy-free diet to support that and ensure you're getting enough. So things like plant-based alternatives fortified with calcium, certain vegetables, white bread. There are lots of ways to get it, and there's a brilliant sheet through the British Dietetic Association which covers calcium sources, so you can have a look on there and see if you're getting enough. But I think if things haven't got better, it's worth, if you haven't seen a doctor, then go and see a doctor. But also you could try a tiny amount of dairy, depending if that was your only symptom, and try and reintroduce if you wanted to. Do you have any thoughts, Alison?
I'm kind of worried about the length of time those symptoms have been going on, really.
Yeah.
There's something chronic going on there, isn't there? And what is that, and what there's some digging to do there, I think, to find out what is actually going on. And like you say, you could try reintroducing calcium, because it's not going to do any harm if it's a dairy intolerance or lactose intolerance, other than you will get the symptoms. So that's a really personal choice about whether you would want to do that or to risk that. And that's a little bit similar to mine. It's kind of, connects again to my one, doesn't it?
That's the next one, yeah. So yours was, I tried an elimination diet in 2005 under the supervision of a dietitian at St Mary's. I could only tolerate boiled potatoes and was discharged without receiving assistance to introduce more food. I'm so sorry that happened. I lived on potatoes, salt, honey and water for years. Now I can only tolerate 21 foods. After nearly 20 years, I'm obviously deficient in whole groups and nutrients and have received no help. Any suggestions, please?
I think I'd want to know that I'm presuming that the person knows that they are deficient, as in they've had testing to see that they are specifically deficient in those nutrients. And then, my first port of call would be trying to correct those nutrient deficiencies specifically. Because going back to the gut issue we talked about earlier, that's really quite important in terms of tolerating foods as well. And then, again, depending on the type of reactions you're having, then it'd be about proceeding with the reintroduction, wouldn't it, really? Which you should have had support with originally. And so I would go again for, the types of foods that you feel you are less likely to react to, or that are very closely related to the foods that you tolerate already. Because you've got 21 foods, so it's looking at what are those foods and what's similar to allow you to expand out what you're having. Again, it's going to be difficult, isn't it, to get NHS dietetic care. I'm not sure. I don't know if you know, Chloe, of anywhere that would support this kind of reintroduction at this stage.
I guess it depends if it has led to deficiency of nutrients, like you say, or
Yeah.
if there is or any other symptoms of being malnourished, like underweight or have lost a lot of weight over the years. So I think it really depends on the situation, like you say. If it was just for a reintroduction, potentially not. If weight was fine, haven't lost any weight, no nutrient deficiencies that are tested for. So yeah, I think it could be a challenge if there wasn't any of that there to potentially see a dietitian on the NHS.
Yeah, absolutely. But you've done brilliantly to get up to 21 foods on your own as well, without any support. Where are we up to? Losing track. Oh, you've got a sleep one. That might be why I'm losing track. I have very disturbed sleep. It's usual to wake up 3 or 4 times a night. If I have tomatoes, it's every 40 to 50 minutes. I'd love to sleep better. I found benefit in putting myself on a low histamine diet, anything I can do. I did try the GP, but they said there was no infection and left it at that.
So we do know that Mast Cell Activation Syndrome can impact on people's sleep cycles. So histamine can directly impact sleep. So anything that's going to help stabilize those mast cells might help with the sleep. So although food is a massive part of that, I often talk to people about like my MCAS toolkit, which includes a stress management and even stuff like sleep hygiene. So making sure you're turning off all your sort of blue lights before bed and that you have a calming routine. Can be really helpful. I talk about gut microbiome all the time because I'm slightly obsessed. But there is a massive link between your gut bacteria and sleep. So there's a really good article on the Zoe blog that I found for someone the other day, which talks about why your gut bacteria might be linked to how well you sleep and how long you sleep. So actually, all of the things we've talked about in terms of making sure you are having as many foods as you can, specifically plant-based foods, is really, really important. And I think that is likely to help long term. It's not going to change overnight by just increasing your plant-based foods, but actually if you can change some things over a long period of time, depending on your reactions, then it might be helpful. Fiber, we do know that might have a mast cell stabilizing effect, and it's definitely going to be good for your gut bacteria. So any whole grains you can get back in, any different fruit and vegetables, nuts and seeds, whatever you can tolerate. And if that is just swapping your white rice for brown rice, then at least you are doing something to support your gut bacteria. So there are things you can do. I think if the MCAS is flaring up, sleep can often be worse. What do you think, Alison?
I mean, I agree. And also with, if you've got other conditions that link with MCAS, like POTS and things like that, again, it can affect your sleep as well. The other thing is if you're on antihistamines, it's worth taking those at night as well, because they can have a bit of a sedative effect. Not that I'm promoting generally sedatives, but I know for myself, I can only take antihistamines at night. Otherwise, I'm not safe to drive. So, that also might be helpful for some people, the timing of medications as well.
So this one is about cold tea and infusions, so a bit of a different one. So any tips for cold brew type drinks without artificial flavorings and sweeteners? I'm struggling to drink enough water. Flavour helps, but can't have any squash cordial due to sugars. I tolerate tea, but not enough energy to make it all the time.
So I'm a huge tea lover. So my first thought was definitely make a flask in the morning. If I'm making 1 cup of tea, I might as well make a flask of tea. So that might be quite helpful in terms of energy levels to do that. And also remembering that there's fluid in foods as well. So if you're having foods, any sort of sauces, soups, gravies, custards, anything like that are also counted as fluid, if that's the sort of things that you like to eat. And then there are a few things that you can have. You're probably going to be looking at kind of some of the kind of herbal, some of the fruit teas. A lot of the ones that are in bags have not got anything added to them. You're going to have to check the ingredients. I know certainly we've got some sort of chamomile and spiced apple and things like that haven't got anything in except what it says on them. So there isn't any, additional sugar, sweeteners or additives like that. So I was thinking of kind of things, and I was thinking things like mint and basil, things like cinnamon, maybe a little bit of ginger in tea, things like apple, pomegranate, generally fairly well tolerated fruits and spices that people could have, or maybe things like rooibos tea, or chamomile tea. And some of those are quite nice cold as well. So if you're not up to getting up and boiling the kettle all the time and messing about, or if the kettle's too heavy, which is another thing if you're struggling, quite a lot of the fruit and spiced teas or herbal teas are nice chilled in the fridge as well. So you could have both. You'd have some hot and make a second one and put in the fridge to have later, so you're conserving your energy there a little bit as well. I don't know what you like to
just
drink, Chloe.
on the tea. Sorry, we've had a tea specific question, so I thought I'd ask this one in the chat. Would it be decaf, as caffeine is a mast cell liberator? Marcel asks.
It depends, really, I suppose, if that is something that particularly affects you. I mean, you could argue that it might be a good idea to have decaf anyway, but I think that's going to be on an individual level, depending on whether you feel that affects you. And again, going back to the sleep question as well, whether that affects you with sleep, because for some people caffeine can be quite helpful. It depends on their particular health profile.
Yeah, I think caffeine's a huge one that people have really different reactions to. So for some people who have huge fatigue, actually the caffeine can be really helpful in making them feel alert for a short period of time. And then for others, depending on other conditions as well, it can make them feel really awful. So I think it's just one of those things where it's kind of personal and see how it makes you feel, really.
Yeah.
And I guess in terms of cold brew, stuff like, you can get these spa waters where you put like cucumber and water and stuff like that just tastes a bit nicer than just having water all the time. My husband always says like he needs some flavour, so I totally get what you mean.
Yeah, I do. I can't do plain water. It has to have something in it. Anything, just something. Even if it's just sparkle, it just needs to have something other than flat water.
And that's a question I get a lot, actually. Like, what with MCAS can I drink in a pub? And it is hard if you can't, if sugar is one of your triggers as well. Like a lot of places don't do non-sugary drinks, so it can be really tough. So I think, finding a drink that you can have is helpful. This is a really interesting one. Like, how do you know when you're out of the woods for having a reaction and it's officially added as a new food? And I guess that goes back to what we were saying before, is reactions can massively change. So I don't really like to think of it as being out of the woods, because MCAS can often do weird and wonderful things. So I would generally try and think of it as what's happening in that moment, what's happening in that period of time, and really trying to think about all the other things that are happening in your life. Like, can you tolerate it at that moment in time? I guess the example I would give for that is during pollen season. My husband has different triggers to outside of pollen season, and his symptoms are massively different too. So things can definitely change. I think it is important that if you've tried things once and react, depending on the nature of that reaction, you don't necessarily just write it off, because it could be another factor or something else you've eaten in that day, or you've had a stressful day at work, or a number of things. So it is important to try it a few times and sort of see. Do you have any more concrete advice for that, Alison?
No, I absolutely agree, because the thing is, you can react differently 1 hour, 1 day, 1 week to the other. Pollen season is an absolute nightmare. We're on, chewing our fingernails all the way through pollen season, waiting for a big reaction to something and having to take something else out of the diet. So, choosing your times is really important, and it can change. So unless you have anaphylaxis, don't assume that because you've reacted to something once, you will always react to that food, because that just isn't the case. And you can reintroduce foods sometimes that you haven't been able to previously tolerate.
Yeah, and if you know that you do have a pollen sensitivity and you have ended up on quite a restrictive diet,
Yeah.
As long as we are supporting you and ensuring you're getting all the right nutrients you need, then sometimes it is wise to just wait it out until the pollen's gone over before starting those reintroductions. Because actually, if you do reintroduce at the wrong time, sometimes I find that adds to the anxiety for people, because they can have bad reactions.
Yeah, absolutely. And similarly, even if you've got, if you've got a virus brewing or something like that, a cold, or touching wood, COVID at the moment, isn't it? Still trying not to catch that. It's not the time, is it, until you're fully recovered, really, from that.
No.
Well.
So pick your moment.
Yeah.
And for you, Alison, is it better to treat naturally rather than take antihistamines?
I would say it's not better, but it's another way of looking at things. So most of the people I see will do a combination of both, and will use, some mainstream medical and some, natural approaches. And I think actually, because of where we are with MCAS, that's generally quite a good way to go, I think. Antihistamines have been around for a lot of years, so we know they are a generally safe medication. However, we also know that some people with MCAS struggle to take antihistamines because they react to them, or to fillers, or whatever else is in them as well. So it's going to depend on your individual circumstances, but I wouldn't just rule out medicine because it's medicine. And equally, I wouldn't rule out natural because it's natural. I would use a combination of both. The more we've got to throw at this, the better, I think.
Yeah, I've seen so many patients with MCAS now, and I think not one of them's treatment plans is exactly the same. And sorry, Joyce, to use you as an example, but I love the slides you've done in a lot of them, showing all of your family's different treatment plans for the MCAS. Like, it's just so different, even in the same family. So I don't think we can say one thing is going to work for every single person. And actually, some people need medications, some people find medications makes things worse. It's really finding out the treatment plan that works for you and your body, which I know is really difficult, because often people just want an answer and say, this will make it better. But actually, it really is piecing together what works for you.
So can MCAS play a role in causing non-diabetic hypoglycemia and reactive hypoglycemia?
So this is something I've seen quite a lot recently, actually. We have no evidence for it in MCAS. So there is a small amount of research that have looked at reactive hypoglycemia in people with POTS, which we know can overlap with MCAS. And reactive hypoglycemia, for those who haven't come across it, is basically when you get episodes of low blood glucose and the symptoms that come with that. So things like dizziness and shakiness, but actually after a meal. So you have just eaten, but your blood sugars are still low. And it can happen between sort of 2 and 4 hours after eating a meal. So I think that it is potentially linked, and we are seeing more of it, but we don't have any evidence to say that is the case. And it can be one of those things that, is hard to manage, but there are ways of really looking at it. So looking at those slow releasing carbohydrates, so something we call low glycemic index. So carbohydrates like oats and boiled potatoes and sweet potatoes, and Alison's a diabetes dietitian by background, so it's probably way better at this than I am. So would you like to tell us more about it, Alison?
We don't have reactive hypoglycemia in diabetes. We have hypoglycemia. But yes, I agree. I see quite a bit of it, and sometimes it gets missed with POTS or autonomic symptoms, because the feelings, the sensations are adrenaline led, so they're the same kind of symptoms: the shakiness, the clamminess, the sinking feeling. They're all autonomic symptoms, so you can mistake it. It's the timing that's key. And I agree in terms of the slow release carbohydrates, but also adding in protein or fat is really important as well to kind of stabilize the blood glucose. And we actually did a little, I'll tell you this little anecdote. We did a little experiment in our house because my daughter has this. And so we did some continuous glucose monitoring, which I generally don't recommend, because unless you've got someone to interpret it, you don't know where you're at. So, for example, you can get what looks like low blood glucose, and that's just your normal level. So I've had people who have done it, and that their normal level is in the upper threes, and they don't get any symptoms, and they're fine. But then with reactive, you can actually see the drop generally after the meal. And we did this for my daughter and saw hers dropped overnight really, really low, and she would wake up really unwell in the mornings. And actually having a sort of fat protein combination snack at night was helpful for her. So if you think this might be affecting you, then it's one to speak to your doctor about, because there are other causes of low blood glucose as well that might need to be ruled out. So if you're getting low blood glucose symptoms, someone needs to look at that and see, whether that is reactive or whether it's something else. You can also get it if you're insulin resistant as well. So, in a sort of pre-diabetes state, so that needs checking out as well. So it's just kind of getting that medical advice before assuming that it is that, I think.
Yeah, and someone asked on the chat, should blood testing be done to confirm it? And I think you kind of answered that in the fact that you should get other causes ruled out. You shouldn't just assume it's reactive hypoglycemia.
No, because there are other causes, and depending on your age and other symptoms that you might have as well, I think it's important to get that checked out first, and then think about how you manage the diet around that. Yeah.
And your question is, what is the reason for constipation and MCAS? Is it because of low stomach acid? I'm also low histamine diet and noticing food isn't digested in stools, so thought maybe that's why the magnesium citrate might help. Many parts of that question.
There are many parts to that question, and just like you thought me with the diabetes dietitian, I thought, and Chloe's more of a gastro dietitian, so that would have been a better question, Chloe.
You've got the wrong question.
However, this is my take on it, then Chloe can sort me out. My take is it's going to be multifactorial. There's going to be a lot of different things that cause constipation in people with MCAS. So the sort of things I was thinking about were, obviously restricted diet. So that's one thing that might cause an issue. Gut motility issues, depending on if you have other things, like if you have POTS or dysautonomia or EDS, you might have issues, structural issues or motility issues, transit issues. You might have something completely unrelated. So you might have IBS with constipation, for instance. So there's quite a few different causes that it might be, and that's going to need to be individually assessed again. I'm not aware of it being because of low stomach acid. I don't know if you can answer that better than I am, Chloe. That's not something I've come across.
No, I think there is a lot of chat online about low stomach acid and taking certain supplements that might help that, whereas actually there's no evidence that is involved. And I think the thing about undigested food in stools, like there is a point where that is normal. So it is normal to see some fiber containing food in our stools. Just none of us talk about it. It's not a conversation you want to have with friends, is it? Talking about sweet corn in your stools. So I think some is normal. I guess what isn't normal is blood in stools, like floaty stools, oily stools, things like that are things you need to flag up to your doctor. Like you say, many reasons for constipation and MCAS. One of the common things I see is if people are hypermobile, sort of delayed motility, sort of slow gut transit, things moving really slowly, and there are things that can help with that. So certain types of fibers, certain types of magnesium for some people, certain medications for some people, there are things that can help, but it can be more of a challenge to manage. And we do know there are mast cells all over our gut as well. So they're in our whole body. So actually, if you're having a mast cell flare up, I see people go one of two ways. It either constipates them or they can't keep anything in them. So it's kind of one way.
Alternating. Yeah.
Some people get vomiting as well. So yeah, it can affect your gastric tract so much.
And they've asked about magnesium citrate as well, and whether that might help. I mean, potentially it might, but also it's quite could be quite harsh as well. It depends a little bit, I suppose, on the cause and on what's going on, isn't it? There might be gentler ways, is what I was sort of thinking.
There's some evidence that magnesium oxide can increase the number of bowel movements you have in a week, but it needs to be at the right dose. So you mustn't take high dose magnesium. That can cause you to have diarrhea. So it's really, really important to get advice about the dose from a health professional. Otherwise, you could do more harm than good and end up going the other way and actually feel just as bad. And I think also probably what's important to talk about is people's definition of constipation can vary hugely. So constipation, if you go to a GP, might mean a really different thing, but often people talk to me about constipation like feeling like they need to go to the toilet but can't, or they are actually going every single day, but it's almost like rabbit droppings. So, you know, there's a massive, you say constipation, but it can mean really different things. So I think it's important to get the treatment you need. And if you are seeing a health professional, not just saying constipated, actually telling them what it's like. And I know you might think that is not a great thing to discuss, but I want to hear all about your poo. So yeah.
Yeah, dietitians do both ends. All the way down, all the way through.
And would a high dose curcumin supplement help with MCAS inflammation released by the mast cells?
There's not really any evidence for it. So curcumin is the sort of active thing in turmeric, for those that don't know, and that's been used as a kind of ancient medicine for longer than we've been around, that's for sure. You know, so it has been used in Eastern medicine for a long time, and it does have some anti-inflammatory and antioxidant properties. So that's also been known about for a while. But the studies that have been done have shown that it doesn't really affect inflammation markers in people with chronic illness. And that's probably because it's not absorbed very well in the gut. So that would be the problem if you're taking it, you know, if you're taking it as turmeric, like in tea or something like that, you're never going to get enough to make a difference clinically. If you're taking it as supplements, it's not very well absorbed. So again, it would be quite difficult to get enough to have an effect. And there are other antioxidants, for instance, in just normal food that might be more helpful as well. Some of the supplements come with lipids or fats, which helps it to absorb. But just beware, because some of them are soya based, and I know quite a few of the people I see with MCAS, soya is something they react to. So it's just knowing, again, when you're looking at supplements, looking at the ingredients and making sure it's not something that you already know that you react to as well.
We still have a lot of questions left, and we have 5 minutes left. So I wonder if we stop answering the questions and maybe do another session, Joy, if you're happy with that. Otherwise, people are going to be sick of hearing us talk, and it's going to be 9 o'clock before we finish. So if you're okay with, shall we mop up the questions in the chat, and so we can kind of close this bit and then we can finish off the questions in another session?
Yeah, that's a great idea.
Yeah, because we've got loads, haven't we? I'm sure people will add more as well. So
yeah, so we could do another one of these. So questions in the chat are: I've been on a low histamine diet for almost 7 months because I can't cope with the impact on my brain after having anything higher histamine. I've developed severe brain fog and attention problems. My DAO levels are not increasing throughout this whole time, so I don't know how I can come off low histamine because the DAO levels are inadequate to support the reintroduction. Yeah, I think that's really, really tricky, and a really tricky situation to be in. Obviously, I don't know if you're on diamine oxidase enzymes. So if you do have a low DAO level, which is the enzyme that breaks down the histamine in our body through the foods that we eat, then that can make the situation more difficult if you've already got MCAS where you overproduce histamine. There are some small studies of histamine intolerance where people have actually taken an enzyme which has DAO from pig kidney extract, and for some people it can be helpful if you take it 20 minutes before a meal. So it might be helpful to try that if you're not already. Do you have anything to add, Alison?
I suppose I was going to say I wouldn't necessarily base my decisions around the DAO levels, because there's probably not enough evidence that blood levels are the same as, well, there's no evidence that blood levels are the same as the gut levels, which is where we're most interested in it. And I think that issue about not being able to cope with the impact, that is just so understandable. If you are feeling better on the diet, then, you know, there's no incentive, is there, to change that. And I think, you know, if you're comfortable on it and if you feel like it's helping your symptoms and you're nutritionally okay, then, you know, maybe you just leave things as they are for now, and then just keep reviewing it, depending on how you're feeling about that.
Yeah,
It's
I
just
think
so
that's really
stressful.
important. Yeah, those DAO blood levels, you know, just aren't accurate enough to tell us anything.
No. So the next one is, I tried not to get worked up about it, but the day after having a tiny amount of tomato in food, I got uveitis flare up the next day. I wouldn't link uveitis to mast cell. I'd be kind of questioning whether there's some other autoimmune condition going on if you're getting that kind of eye inflammation. But I suppose it's a little bit about causation, correlation. You know, is it a coincidence that it was the tomato, or was it the tomato? And the only way to find that out would be to try it again. But I'd wait until you're feeling, you know, in your best place to do that, as well.
And any advice in fermented foods? I have MCAS linked to long COVID, hearing lots of advice about having fermented food for your gut microbiome, but also not to eat fermented food as high histamine. Feel confused. I think it's really understandable to feel confused. Like, fermented food seems to be talked about as almost the only option to support our gut microbiome, which is absolutely not the case. There are so many ways you can support it without fermented foods. So plant-based foods are key. So as many different types of plant-based foods you can eat in a week. So whether that's whole grains or fruit and vegetables, nuts, seeds, beans, pulses, spices, herbs, whatever you can get in. If you, in terms of histamine and fermented foods, yes, they do contain more histamine. Like we've said, not everyone with MCAS is sensitive to histamine to the same degree as another person. So it really is finding your own threshold. So my husband can tolerate small amounts of yogurts, but he definitely wouldn't be eating kimchi every single day. It really is finding out how much you can get away with in terms of that. But I wouldn't be thinking of fermented food as the magic bullet to your gut health.
No, and something that's quite nice and I find quite positive is thinking of the 30 plant points thing. So if you search it on Google, it's really just, you know, trying to get 30 different types of plants in your body over the course of a week. And it's quite a nice, positive way of doing it, because you can do it with the type of plant foods that you can tolerate as well.
Yeah.
And yeah, we still eat kimchi in this house.
I've been told by my 4-year-old I'm not allowed it in the house anymore because it stinks.
Yeah, it does.
So I think this goes back to the pregnancy question that we got asked about dairy. So I've got doctors soon for my symptoms. I was diagnosed with IBS in 2005 after the birth of my first child, but I believe it's something else, possibly MCAS. I have odd episodes, maybe 6 times a year, severe diarrhea with like labour type waves. I would swell up, itchy throat, but sometimes I just get instant bile type diarrhea. Coffee, white, and creamer is one trigger. Alcohol is 100% no. And every time I've had a full episode is after a roast dinner. I've had no tests, so hoping doctor will do bloods and stool tests. Is there anything else I should be bringing up to the GP? My symptoms flare after childbirth, as I just had my 4th and it's flared again. I think that is a really important thing to notice, is that hormones can massively impact gut symptoms generally, but also it can have an impact on MCAS. And there was another session, I think, on hormones and MCAS, because it can have such a huge impact. So, and the physical stress that childbirth brings on the body. I don't have MCAS. My body is not the same almost 5 years later. So
22 years for me.
So I think it's really important that you just go into detail with your GP about everything you've gone through, and it is so important you do get testing, because it's not okay to have to go through that and live like that without any testing. So celiac disease testing, stool testing, but there will be certain tests the GP should do if you've got those symptoms. So it's great that you've managed to book an appointment, and hopefully you'll finally get help for what sounds like a really, really long journey for you.
Yeah, it's that, hormones people often find with all sorts of different chronic conditions, autoimmune conditions, MCAS, lots of things that times when hormones are rife are times when symptoms change or ramp up to the next level of symptoms as well. So yeah, absolutely, but definitely needs investigations.
So I've been trying a gluten-free diet for 4 weeks now, which seems to be helping my already diagnosed severe bile acid malabsorption as well. I don't have a celiac diagnosis. Is it okay to stay gluten-free? It's helped lift my mood and crack a bit of the extreme fatigue finally.
I suppose again, I'd be wanting to make sure some investigations had happened into the malabsorption. You're saying it's already diagnosed as severe bile acid malabsorption. Is that being treated? Is it being treated optimally? That would be my first thing. Have you been tested for celiac? Because you can have more than one gut condition. So I'd want to make sure that that was ruled out. And then I'd be thinking about, if the gluten-free diet does seem to have helped you, would you consider reintroducing some gluten foods and actually testing that out? So, once you've had testing, you'd have to introduce them anyway for testing, won't you? If you're going to have celiac testing, if you haven't had it before, you'll have to be eating gluten at least 2 meals for 6 weeks beforehand to get that testing. But if that has been done, then I'd consider trying to reintroduce something with gluten in to see if it does bring the symptoms back again or not. But also be thinking about whether it is the gluten or whether it's another aspect of that food. One of the starches or carbohydrates in that food that's affecting you rather than the gluten. I don't know what you think, Chloe. More gastro again.
Yeah, so being gluten-free wouldn't necessarily make bile acid malabsorption any better. So it's often fat is a trigger for bile acid malabsorption. The only treatment for it is either use of medications, or if that isn't doing enough to control it, then a low-fat diet. However, saying that, a lot of people I see have severe bile acid malabsorption and IBS alongside, so other foods do tend to trigger it as well. I think gut conditions rarely come on their own. That unfortunately they often cluster together. So I think as long as you're, obviously the testing, which Alison said, is really important. So if you don't want to be tested and you haven't been tested before, I think as long as you're getting all the nutrients you need on a gluten-free diet, then it's okay. But being gluten-free can do things like reduce the fiber that you're having. So it is really important to sort of look at your diet as a whole. And how best to support your body if you catch COVID?
Rest, 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 and rest. And don't push yourself. That's my huge, for anyone whoever's had a post-viral condition, then definitely do not push yourself to get better. Plenty of fluids, plenty of back to plants again, plenty of variety of food if you can manage it, you can stomach it. But essentially rest and fluids is going to be the most important, I think.
Yeah, absolutely. I think, and eating what you can and what you fancy, and just getting through it to the other side. Yeah. There's some stuff come back from the person that was asking about the DAO levels, just that they are taking DAO, and they can't cure histamine intolerance, no. So, and is histamine intolerance reversible? It really depends on the cause. Like for some people, histamine intolerance in itself might be made worse by gut bacteria imbalance. It might be made worse by hormones. So sometimes histamine intolerance and the level of it can change. But I don't know whether it can be fully reversed. Especially if it depends if MCAS, obviously you're here, so you've probably got MCAS as well. So I think it's unlikely to be reversed, but it can definitely be managed.
I think we don't have a cure until we know the cause, do we? It's that kind of backwards working, isn't it, with the science? We need that. We need more research, basically, on all levels.
Yeah. So much more research we need. Yeah, absolutely. So that is the end of our questions. We will do another session, and yeah, thank you so much for joining us both. It's been great just to chat about it, really. I've quite enjoyed chatting to you, Alison. Thanks.
That's good. Maybe we should do it more often, like a double act. Laura and Hardy reinvented.
We
we'll
absolutely have to say a huge thank you to Chloe and Alison, not just for giving up their time this evening, but all the prep time in getting ready to answer the questions and looking at them beforehand, and also for everything else they do as part of our advisory panel and just helping us to try and provide information and resources to help everyone in our community. So thank you both, because you're superstars and you're making so much difference to lots of people, and we love you lots. So thank you.